We got a couple of things in the chat.
Yeah, I saw that. Okay, hello everyone. Welcome this evening to our Shop Talk, UPBCA Shop Talk. We have a very great topic on this evening for this month. It's disrupting the colorectal cancer disparities in urban Black men. And I'm sure that we also can probably include that to people of color, also the Latinx community as well. But we're so elated to have our guests with us this evening. My name is Willie Lightfoot. I am the president of the United Professional Barbers and Cosmetologists Association. I'm also joined with my vice president, Wade Davis of the United Professional Barbers Association, as well as Wilhelmina Sizer, Doctor of Nursing Practice student of U of R, Dr. Janelia Marino, Associate Professor of Medicine of the U of R, as well as some of her guests that they will be introducing very soon. Yvette Connors, Christopher Walker, and of course, Lady V, which is my wife, is also on our line with us this evening. We're so glad to have this. This is a very important topic. And when Wilhelmina came to me with this particular topic, I realized that I'll be turning 49 this year. And as a result of that, I'm going to lead by example, and I'm going to have my screening in July. I've already scheduled the screening for July, and I will be going in before my 49th birthday to get my screening. And so we as barbers and beauticians, oftentimes we say it all the time, people don't normally change their spiritual leader, their doctor, and of course their barber and beautician. So we are very fortunate to be able to talk to our clients about very important topics, and especially around health. And so I'll turn it over to Vice President Wade Davis just to tell you briefly about his experience with the colorectal screening.
Thank you, President Lightfoot. I just want to say welcome everybody to this Shop Talk, UPBCA Shop Talk. As Brother Lightfoot said, I have just hit 61. So I've had this thing since 50. And I know it's my time again. My doctor told me that it's almost about time to get checked again. It's been about 10 years. My experience, well, as a man, right? I don't care if you're African-American, Latino, Caucasian, Filipino. As a man, I had issues with someone going in my backside to check me. And I think that, you hear so many stories. You hear so many stories, just as we hear stories about the vaccination shot, right? People got their own stories that they put out there. Oh, it hurt, this and that. And, I kind of listen to that. And then we already know that as males, we are not as, we don't get our checkups. We don't go to the doctor as frequently as our women do. And, so I was dealing with that. And just the fact that someone had to go through my rectum to check something kind of gave me some pause there. It did. It gave me some pause. But I was so happy to find out that, my doctor, who I've had for years, it was all right. It was all right. And I wish it was a lady, but I had a male doctor. So that also had played a part in my trepidation about doing this. But, it didn't hurt. After I did it, I felt good about the fact that I got myself checked, and it was just encouraging. It was just encouraging to find out everything was okay. You see what I'm saying? It was really encouraging to find out everything was okay. So if I would say anything, I would think that the mental part of it was more of an issue for me than the physical part. Okay, I got over the physical part first because it's my doctor. Boom, he's gonna be careful. He put on his glove, all that kind of stuff. But it was the mental part for me that I had a problem with, and I think that that's probably the issue with most men. That we have to go through that, and somebody have to go through such a delicate part of our bodies, a part that we're not really used to anybody. And I'm, and I know that's for anybody. We're so, I had issues with that. But I was so glad that I did it, and I was encouraged by the fact that I came out, everything was okay. Nothing was found, and I'm kind of anxious, and I was excited about the fact that we were sharing on this with our UPBCA shop talk on tonight, because I know that my doctor has been saying, "Hey, it's time to get checked again." So this is a great opportunity for not only myself, but for other men to hear that this is important. It really is important. Cancer is no joke. It's just as deadly as the coronavirus. Cancer is no joke, and I think that we as men need to take every step and every measure to make sure that we get ourselves checked out and make sure that we are okay. Um, I'm not really sure, and I don't even want to attempt to say how often, because I know that we have some experts on here tonight that's going to share all the pertinent information in terms of how frequent we need to do this, and the benefits of it and things of that nature. But if I would share anything, and then I'll get off, is that it was the mental part for me. Really, it was the mental part. And once I got past that, I was okay. I was okay, and very much so looking forward to my next opportunity to get rechecked again. Okay. So that's kind of like the extent of it, Brother Lightfoot. It was just a mental thing for me, because of the how they had to do it and where they had to go in to get it done. You see what I'm saying? So that was it for me.
Well, thank you, Vice President Wade. We also, one of our members, Aretha, is with us as well. We glad to see her here. But at this time, I'm going to turn it over to Wilhelmina Sizer and Dr. Marino to begin their presentation around this very important topic. Thank you.
Thank you. That was a great story, Mr. Wade.
Thank you. Thank you.
Let me go ahead and share my screen. Willie said I have a lot of things on my screen, so let me.
You know what, Wade? I always tell my patients, like, any of those concerns that people have, they seem like a big deal to you at the time, and I don't want to negate any of those concerns because they are legit. But I always say, put it in perspective. Compare it to what would happen if, God forbid, you ended up with cancer and you needed to go through surgery and chemo and all that horrible stuff. So, that worry and that uncomfortable feeling about where we had to go and all that pales in comparison to what you'd be feeling if, God forbid, you ended up with cancer.
Exactly, Doc. I agree with you 100%.
Yeah. So thank you for sharing that, because I know a lot of people feel that way, and it's something that people feel uncomfortable talking about. And that's why we're here today.
Right.
So take it away, Wilhelmina.
All right. So tonight we're talking about colorectal cancer screening, and I'm Wilhelmina Sizer. That's Dr. Marino over there.
I also just want to introduce Dr. Christopher Walker. He's one of the gastroenterology fellows at the University of Rochester, training to be a gastroenterologist.
Okay.
He also has a big interest in healthcare disparities and community outreach for colon cancer screening.
And then we also have Dr. Yvette Conyers, who is my faculty advisor from St. John Fisher College. All right, so I wanted to start off with a question. And if no one answers, that's fine. I'll talk about it anyways. But I was wondering if anyone could share the story of barber surgeons.
Oh, I could share that story. I'm presently teaching at the Rochester Educational Opportunity Center. I've been doing that now since 2011. And barber surgeons, actually, that's where we got our prominence in the community that we still have today. Barbers was actually doctors. And back in the tribal times, back in BC, barbers were really prominent because people felt like evil spirits were in your hair. You can get rid of them by the cutting of your hair. For the high priests and all those that were involved with the religious services, they had to be purified, and they depended on the barbers to take care of that. And that's kind of like where we got our prominence. So barber surgeons were not only cutting hair, but we were doing a whole lot of bloodletting back in the days. We were doing a whole lot of bloodletting. And thank God, with everything that's going on now, with all the different diseases, all the different viruses, and all the different things that we are so subject to today, they separated it. And I can't give you the exact year, but I think it was around 1800s or somewhere around there. They separated it, and barbers could no longer practice barbering. And doctors, it was doctors, and then there were barbers. And the pole represented the fact that if it was, I think if it was red and white, it was barbers, and if it was blue and white, you were a barber. So we kind of got it like that. But barbers were very prominent in the bloodletting services and handling a whole lot of medical stuff. And it just wouldn't work today with infection control and things of that nature that we have to abide by now. It just wouldn't work. So,
and can I just add also, I see you're showing the barber pole. So the barber pole was significant of that bloodletting with the red, white, and blue. The bandage, white for the bandages, red for the blood, the blue for health, and the bloodletting thing that they would hold in their hand when the blood would flow down to the bottom of the plate, which is how the barber pole was created, or the premise behind the barber pole.
Thank you. You guys took the words right out of
Just
my mouth.
nailed it.
Yes. And it came from professionals, so thank you. So I think it's interesting to start off with, the origins of barber surgeons and where we're at today as far as, the importance of barbers and cosmetologists in the community. Even though now current days, you guys are not barber surgeons, but, you're looked at as mentors in the community. Barbershops and beauty salons aren't just a place where you go get your hair done or get, any kind of services. This is a place where conversations occur about, what's going on in the community and what needs to be done. So I think it's very important to even take that transition from back in the Middle Ages to where we are right now. And even though surgery is not being performed, you guys have a very important role in the community.
Especially around health.
yes.
Yeah. So when we talk about colorectal cancer in the United States, it's the third most common diagnosed cancer, and it's the second leading cause of cancer-related deaths. So as we look at the trends and the incidence and mortality rates overall, there has been improvement. You can see from 1970 to 2017, 2018-ish, the incidence and mortality rates have gone down. But in this graph, you can see the red line represents Black individuals, the green line represents white individuals. And just a comparison of the two, you can see that Blacks have higher rates of incidence and mortality despite the improvement in the rates overall.
So Blacks get cancer more, colon cancer more, and they die from it more than whites.
So if we look closer at trends in mortality or deaths from colorectal cancer, you can see in 2017, for every one white individual who died from colorectal cancer, you had between 3 and 4 Black individuals who died from colorectal cancer. So colorectal cancer is preventable, treatable, and beatable. And what is meant by this is that colorectal cancer is one of the only few cancers that can be prevented with screening. And if colorectal cancer is found and treated at its earlier stages, there's about a 90% 5-year survival rate. So exactly what is a colon? So the large intestines or colon, which is this orange, red, tubular structure that I'm kind of outlining, connects the small intestines on one end and then the anus on the other end. It's in the colon that water, nutrients, and electrolytes are absorbed from partially digested food. And this is what a colon looks like from the inside. So you can kind of see that the mucosa or the lining is nice and smooth, and you can see surrounding small blood vessels. Both pictures represent the same normal looking colon. Now, colon polyps. These are small clumps of cells that can form in the lining of the colon. Most are harmless, don't cause symptoms, but over time, these can develop into cancer. So the goal is to identify polyps, remove these polyps, determine what kind of polyp it is, and then come up with a plan for repeat colonoscopies in the future if you have polyps. So these last two photos on my right shows a polyp being snared and removed during a colonoscopy. So as we look at polyps over time, so this slide is showing the progression over a 10 to 20 year period. You can see, I don't know if you can see my pointer, but
Yep.
Okay, so over here is nice normal mucosa or the lining of the colon. You see a polyp forming right here, left undisturbed over some years. You see that it can change or transition into like a stage 1 cancer. So the tumor in stage 1 can break that mucosa that lines the colon, but it does not connect to the lymph node. That green structure is like a lymph node. And lymph nodes serve as like vehicles that can travel to other parts of the body. So stage 1 is pretty confined. You can see stage 2, which is a little bit bigger. Tumor has grown in size. Once again, it has, this one has broken through that first layer of the mucosa, but once again, it's not communicating with the lymph node. Stage 3, once again, the tumor is bigger in size. It broke beyond the barriers of the colon wall, and you can see that it's communicating with lymph nodes. And then stage 4, bigger tumor, and still communicating with lymph nodes, but now it has spread to other organs. And this is like a 10 to 20 year time period.
So the important point here is that it takes a long time for the polyp to turn into cancer, and that's an opportune time for us to intervene.
Exactly. So this slide shows a moderate sized polyp. And then this other photo represents a polyp that changed into cancer. You can see the difference. So this slide is just reinforcing how important it is for screening. So you can see as colonoscopy, the percentage of colonoscopy screenings go up, and it's represented by these blue bars. As screening goes up, the incident rate of colorectal cancer goes down, and that's what's represented by that red line that's declining. So this is the whole purpose of like many interventions, is to get the colonoscopies or any kind of colorectal cancer screening completed so that we can get decreased incidence rates from colorectal cancer. So as we look closer to home, looking at Monroe County, and we're looking at incidence rates. So from 2013 to 2017, you can see where Black males topped the list, and they had 60.2 cases of colorectal cancer per 100,000 people compared to white males at 39.3 incident cases per 100,000 people. And this is kind of what's targeting the whole project, why we picked out Black men. And you'll see why urban came up next in the next few slides. But if you look at females, it's the same issue. I just gotta move your faces. Hold on. Okay. So if you look at females, it's the same issue. So you have 44 new cases of colorectal cancer per 100,000 people in Black females compared to 32.7 per 100,000 people in white females.
And Doc, as the Hispanic, the Latinx population, it appears to be just as a disparity, correct?
Yep, right behind. So in the population, both, you can see like the disparity is there. Blacks, Hispanics, going across the board.
So I have a question real quick, Doc, if I may. So I wrote it down. I'm wondering why is African Americans and Latino, why is that? Is it because of what I've said in the beginning about, we have a issue and we can't get past the mental part, or does it have something to do with our genetic makeup? As it has, why? My father died from cancer, and he had to reach the 4th stage because his lymph node, he got to the point where the cancer attacked his lymph nodes and it was throughout his whole body. So there was nothing that could be done. Tried everything, but there was nothing that could be done because it had spread it so much. So
Sorry to hear that, Wade.
my question is, as looking at your graph and looking at your information here, African Americans and Hispanics, low poverty, why? I'm wondering why is it so prevalent with us?
That's a great question. And the thought is, it is likely not a biological reason. It's likely not genetics.
Okay.
Unfortunately, it's more likely due to disparities in getting healthcare, in systemic racism, in all the problems that have put you behind, in lack of access to healthier foods, all of that. So it's not in the genes, it's a problem with the healthcare system and getting the care that you need. And that's why we're trying to fix it.
That's a great question. Okay, so continuing on in Monroe County now, as we look at mortality, so before we were talking about new cases of colorectal cancer, when we look at mortality, it's the same pattern. So from 2013 to 2017, you had 18.2 Black males were dying from colorectal cancer, 18.2 per 100,000 people. And then if you look, white males were dying at 15.3 per 100,000 people. And once again, Black females, 11.4 per 100,000 people compared to 9.5 per 100,000 people in white females. So looking even closer in the city of Rochester, and it's called like a focus area. So in this map, you can see, so what it means, like this dark orange color represents areas that had less than 47% of people, of the population undergoing colorectal cancer screening. So you can see some of these zip codes are hard to see, so I kind of listed them out. So it includes portions of 14606, 14613, 14611, 14620, 14608, 14605, 14621, and then 14610. Then you can see this beige color, which represents at least 68% of the population have undergone colorectal cancer screening. And what's interesting is that the neighborhoods included in this beige area are portions of East Avenue, Park Avenue, and sections between Culver and North Winton Road. So once someone has symptoms, it's usually too late. So we want to catch it before the onset of symptoms. And those symptoms are rectal bleeding, abdominal pain, anemia, weight loss, and fatigue. So what are the risks for colorectal cancer? So age is definitely a risk factor. Typically, colorectal cancer is seen in the older ages, but recently there has been increasing rates in those under or less than 50 years old. An individual has a history of polyps has an increased risk, family history of polyps or cancer, diabetes, race and ethnicity is a risk factor with Black/African Americans and Ashkenazi Jews topping the list. obesity, those who consume diets high in fat and low in fiber, smoking, and alcohol use are all risk factors. So family history. So this is very important. So it can play a role in someone developing colorectal cancer. So if an individual has a first-degree relative, so that's a parent, a sibling, or a child who gets diagnosed with cancer, or any two relatives that are not first-degree relatives necessarily with colorectal cancer, you should, or that individual should start screening or getting checked for colorectal cancer 10 years prior to the youngest age of that individual getting diagnosed. So say you had two cousins who got diagnosed with colorectal cancer, one at the age of 50 and one at 80. So ideally you would start screening at the age of 40. And then also there are some cancers or syndromes associated with colorectal cancer, like bladder cancer, brain cancer, and endometrial cancer. So this just speaks to the importance of knowing your family history. For the most part, the days when a family doctor took care of the whole family, it's over. So that one doctor knowing that Uncle Rich and Aunt Betty both had cancer and told you when to go get your colonoscopy, you know, those days are over. Now people have different providers. No one really knows what's going on. So it's up to you to kind of point out, you know, what's in your family history, and then kind of being an advocate for yourself about what needs to happen.
And talking about it with your families, like we talked about before, you know, it's not something people feel comfortable discussing really, but it's so important because people do need to be screened earlier. And so, you know, just letting your family know if you've had polyps or if you know that your dad had colon cancer, making sure that everyone in the family knows that, because it impacts when they would need to be screened. So it's really upon each person to kind of talk about their family history, ask about their family history, and bring that information to their doctor.
And it's also important, like Wade, you said, when you had your colonoscopy, like not to just take the word that you're good for X amount of years. Find out, like, did I have polyps? You know, get specific and say, how many polyps did I have? And then follow up, like, you know, what kind of polyps did I have? So that way you'll know, you can spread the word to the rest of your family too, you know, what that actually means.
If I might share with you, you ladies and gentlemen, is there, you know, I'm kind of scared right now. I am, because some of these signs you have been happening to me. And I haven't been checked for this in about 10, 11 years. So when I go to my doctor next week, I'm gonna be like, yo, I need to get checked for this, because a couple of these signs that you just put on here, this last screen, I have experienced them within the last year.
And you know what, Wade, those signs can be of many, many different things. So, you know, most of the time, if you have abdominal pain, it's not colon cancer, it's something else.
Okay.
But those are the signs that people shouldn't ignore. They should bring up to their doctors, because it's the doctor's job to figure out, is this something concerning or is it not?
Okay.
But yeah, so I don't want you to be scared, because
Yeah, I'm like,
majority is it's something else, most likely, but it is important to talk to your doctor and get screened at the time that you're due. So it sounds like you're pretty much due now.
All right, so screening guidelines. This is fresh off the press. So current screening guidelines for actually all individuals is that, you know, you start colorectal cancer screening at the age of 45 and continue until you're around 75 years of age. And this was recently just recommended within the last week or two. So
It used to be 50. It used to be 50 or 45 for Blacks. Now it's 45 for everyone. And the 75 is not a strict cutoff either. It really depends on your health. So talking to your doctor around that age too about whether you should continue or not is important.
What is the frequency? Is 45 to 75, or what is recommended?
Is that on your next slide, Wilhelmina?
So I think it will, yes, it's coming. All right, and Dr. Marina, you can take over from here.
Okay, next slide. Okay, so there are multiple ways to do colon cancer screening. It's not just a colonoscopy. And ultimately, the best screening test is the one that gets done. So, as barbers and cosmetologists, beauticians, like, we want to empower you guys to talk to your clients about these things. And so kind of educating you on the different options and what's available. So we kind of group them into, at the top, the two-step tests, meaning there's a one test first, and then if something's found, you have to then go through with the colonoscopy. Or there's the one-step test, which is the test where we can go in and take out polyps at the same time. So for the two-step test, it's basically there's two different kinds of stool tests that can be done. The multi-target stool DNA test is a test that looks at actual mutations in the DNA or in your genetic makeup in the stool. And when there's a cancer or some polyps, there'll actually be mutations found in the stool. And that test has to be repeated every 3 years. The fecal immunochemical test, or FIT, is a stool test that looks for blood. So some polyps and cancers do bleed intermittently. And so the stool test will look for blood. And then if that's positive, or if that DNA test is positive, you need to go ahead and go through a colonoscopy. And then the CT colonography is a CAT scan. It's otherwise known as a virtual colonoscopy. That one is, less invasive. You don't need to be sedated for that procedure, but it is usually not covered by insurance unless for some reason the patient has not been able to have a completed colonoscopy. The other problem with that one is they do a picture of your colon, and if they find any polyps, then you have to go back and do a colonoscopy separately. So it requires you to do the clean out of your bowels twice. The CT colonography has to be repeated every 5 years. And then when we talk about the one-step test, so there's a flexible sigmoidoscopy that basically just looks at a part of the colon, just the lower part. That gets done every 5 years if there's no polyps. And then the colonoscopy looks at the entire colon. If there are no polyps, that's repeated every 10 years, but the frequency depends on how many polyps, the size of the polyps, and your family history. So it's anywhere from 1 to 10 years. Most commonly, it's between 5 to 10 years. Next slide. So just kind of going through, so this is an example of that multi-target stool DNA test. The company sends the kit to the patient's home. They have a bowel movement in that big white container, and then they just kind of take a sample of it in the small container and then mail it back to the company. It's non-invasive, doesn't require, a procedure, an appointment, any of that. But if it is positive, you have to go through with the colonoscopy after that. Next slide. This is an example of the FIT test, which again is the stool test looking just for blood. This test is not as good as a colonoscopy. It finds colon cancers about 70% of the time. So that means someone could have a colon cancer and still have a negative FIT test. But if it's done every single year, it's bound to pick it up, at some point over those few years that the polyps or tumors are growing. So again, best screening test is the one that gets done. So for people who have barriers to being able to get a colonoscopy, this is a great option where they just have to have a bowel movement, brush it looking for blood, put it on a card and send it in. This is an example of that CAT scan where you go in a tube, they take a quick picture. This does require a clean out of the bowels, just like a colonoscopy does. And again, if a polyp is found on that, then you have to make a separate appointment for the colonoscopy. So, and it's often not covered by insurance. Next one. So this shows you what a sigmoidoscopy does. So it just takes the scope with a camera on the end and looks in the lower half of the colon and looks for polyps. If a polyp is found on this portion of the colon, then it would be recommended for you to come back to have a full colonoscopy. And this has really fallen out of favor because, if you're going to make an appointment, get sedated, get a ride, all of that, you might as well just have the whole thing. This way, you don't have to come back for another procedure if a polyp is found. And also, this only looks at about a third of the colon. Whereas if you go through the full colonoscopy, we look at the entire colon and make sure there's no polyps that could possibly turn into anything. Next slide. And then this is just showing how the colonoscopy is done. So you do a clean out the day before, and then we take the scope with the tube with the camera on the end and take a look all around. The procedure takes about 30 minutes, and you're sedated and sleeping for the procedure. Next. So there are barriers to colonoscopy. Do you want to do this part, Wilhelmina, or you want me to?
You can keep going.
Okay. So first is the prep. And, a lot of people are worried about having to drink a lot of liquid. That's a laxative that helps clean out the bowels the day before. But you saw those pictures that Wilhelmina showed early on. It's beautiful in there. There's no smell. We can see everything. We can make sure there's no polyps and give you the best exam possible. So the preparation is really, really important. But patients often worry about this one. But just like I said in the beginning to you, Wade, I would take, sitting on the toilet for half a day having diarrhea over having to go through surgery or chemotherapy any day. So it's one day, it's a little difficult, but it's so worth it. And if there are any issues like nausea and things, the doctors can help you kind of work through those. Next. Another barrier is exactly what Wade brought up. The tough guy, I'm a man, I don't want anybody going in there. That's exit only, that kind of thing. It makes people feel uncomfortable. But again, it's uncomfortable for one day versus a lifetime of uncomfortable from developing cancer. So it's something that, you can discuss with your clients when they bring that up. And it's something that, I think as men, you guys always feel like it's your responsibility to take care of your family, take care of your woman, and you can't do any of that if you're sick in the hospital, if you're undergoing chemotherapy. So the most macho thing, the most manly thing you can do is take care of yourself so that you're there to take care of your family and your wife, your woman, whoever else needs you. So I feel like that, it takes a little getting over, but it's worth it. Next barrier. You need a ride because you do get sedated. So someone needs to drive the patient to the procedure. They need to take maybe time off of work, time off of their home responsibilities, whatever it is to get there for the procedure. So that can sometimes be a barrier. But that's something that, you as barbers and beauticians can kind of talk to your clients about ways they can work around that, talking to their friends and family, making it a priority. Employers should make it a priority, and many do nowadays make it a priority to give patients time off from work to do these things. But again, if this is the barrier where people there's no way around it, then maybe the stool test is the way to go. Do the stool test first, and then only if it's positive do you have to go through the difficulty of trying to, overcome these kinds of barriers. And finances is sometimes a barrier as well. If people don't have insurance, or if they have insurance, but they have a high copay or a high deductible. But we'd hate for anyone to make money the barrier to the care that they need. And so there are options out there, namely the Finger Lakes Cancer Services Program, which will cover an annual FIT test, stool test for people that qualify. And if that's positive, they cover the colonoscopy. If the colonoscopy finds a cancer, they even cover the cancer treatment. So it's really important for people that are either uninsured or underinsured to get signed up with this cancer services program. Next slide. And the website for that is getscreened.urmc.edu or getscreenedrochester.org, getscreenedfingerlakes.org. Those are all the same website that bring you to this program. There's also the phone number and the email there. And basically, if you call and get enrolled or email and get enrolled in this program first, as I said, they'll cover the screenings and everything. So we don't want finances to be a barrier to anybody getting the screenings that they need and they deserve. Like I mentioned, they cover the FIT test for average risk patients. If patients are high risk, so if a patient had a significant family history where they need a colonoscopy and not just a stool test, the Cancer Services Program would cover that as well, straight colonoscopy without having to go through the stool test first. And this is all funded through the New York State Department of Health. I just also wanted to put in a plug for Strolling for the Colon. This is a nonprofit organization that I am involved in. We have a 5K run every year, and this year it's going to be on September 11th at Mendon Ponds Park. Strolling for the Colon is actually funding this project that Wilhelmina is doing to be able to educate you all so you can educate your clients and to allow us to support this program to get you and your clients in for screenings.
Okay. So at this point, I think it's important just to reinforce like the importance of barbers and cosmetologists in the community. You know, as mentors in the community, I feel like, or the thought is that, you know, you guys, if you could start this conversation around colorectal cancer, hearing it from someone they're familiar with, someone they trust, may go a lot further than just hearing it from a healthcare professional. That includes just letting them know, you know, do you know about colorectal cancer? Do you know like how prominent it is within this community? Do you know about your family history? Do you have a primary care provider? If not, do you know you can still get screened? Just kind of going through like troubleshooting to see, you know, what could be potential barriers. I know, Mr. Wade, you spoke about your one barrier to undergoing a colonoscopy, but I guess what do you guys feel like are other barriers out there?
You know, if I would add anything else to it, I would just say, just the fact of finding out that you have it. You see what I'm saying? A fear. Fear is big. Fear is big. On a lot, finding out about a lot of things. People are just afraid. I'd rather not know. Let me just, you see what I'm saying? So I think fear would be another barrier.
Well, this is Aretha. I will add that, first of all, I'm thankful that you all are presenting this way. I myself just did the Cologuard about 2 weeks ago, and also did it, I believe about 2 or 3 years ago, because I'm at that age. I'm 53 years old, and my father has prostate cancer, or he's a survivor of prostate cancer, and my sister was diagnosed at 47 with colon cancer, and she passed at 52. So for me, you would think that I would run and get it done, but I was like what Wade just said, I'd rather not know, and I would rather live my life healthy and keep my mental intact. But now, since you've presented it this way, I'm more apt to having the colonoscopy done and sharing it with my customers, because like you said, we are a huge influence to our clients, and they do listen to us, and they trust. So, and then with you bringing up the story about the barber surgeons, my father is a retired barber, and I would love to pay homage to that, just knowing that what we're sharing, this medical information that we're sharing, can save lives. And for me, that makes me feel like a barber surgeon or a cosmetology surgeon. So I am in awe of what I've learned tonight, and I thank you.
Awesome. Thank you so much, Aretha. That's great. And yeah, I mean, you guys can save lives just by talking about this. Even if one of your customers goes through with it, you could save one life, and that's amazing. I would also say, you know, when people have a family history, as you do, colonoscopy is the best test. So, having the stool test is great. And I said any screening's better than no screening, but when there's a family history, you really should have the best possible test because we can prevent cancer with that more than just looking for it. And we'll give our emails at the end as well. You can feel free to reach out to me, Aretha, if you want to set up your colonoscopy.
Okay, thank you.
I would reinforce, I love everything that I've heard. I would reinforce the fear barrier, being that I think all of us, Wade, Aretha, myself, all have something in common. We all have parents who have passed away or family members with cancer. My father passed away at age 60 with stomach cancer. And as Wade was saying, it was in a very late stage by the time he did find out. And so I have a family history. Many of us have family history. And I think because of the family history, I think another barrier is the lack of education and or how that education is presented. We just heard Aretha say how this was presented tonight was very helpful and encouraging for her. And I think that's where what you guys are doing, utilizing and engaging this particular community through barbers, beauticians, estheticians, appearance enhancement industry is very promising because it will be presented to them in a different manner. And I think the fear factor, because many know that they've had family members who have a history within their family, many have not necessarily connected that history to them potentially being at risk. And so when information is provided to connect the dots, if you will, and say, you know what, if you look at that family history, most likely, my father was the Mr. T guy. He never wanted to go to the doctor. Oh, I just take some Pepto-Bismol and I'll be okay. You know what I mean? Or ignore and be going through pain. And so with this presentation and with the education that we are being provided, not only can ourselves move to get these tests, and then we become ambassadors, if you will, because we can say, hey, I took the test, I did it, I'm at risk, I've had these factors, these risk factors in my family. Maybe you may have the risk factors too. And as Wade said, as Aretha said, now, look, it doesn't hurt, it's okay. You know what I mean? You're not going to be violated in any way, and we could hopefully help to save lives. And so I think that one of the barriers is the educational piece and how the education is presented.
Absolutely. Willie, that just reminded me something, because a lot of times I hear from people, well, I have no family history, so I'm not at risk. I don't need to worry about it. And that's actually completely false. Those with a family history are at higher risk, like we've been talking about, but everybody's at risk. And actually, most people that are diagnosed with colon cancer have zero family history of colon cancer. So that, people rationalizing, well, it's not in my family, so I don't need to worry. That's not true. And people need to be educated on that as well. And so, our goal was really to give you guys the tools so that you could speak on this to your clients. And we're hoping to kind of develop some, maybe like a laminated card you could have in your pocket with some talking points that you could talk to your clients or customers about when you bring up this topic. And so we'd love to hear your thoughts on, if you think, how we can support you in that, or what questions or concerns you think might come up that you'd like some tips or tricks on how to answer.
Yeah, I think the card would be helpful, but I would also encourage having some type of laminated, I always, or a poster, right? Because many of us have areas within our shops that we can post. We post flyers, etc. So if there's a poster that says, hey, that may list, some of the opportunities or risk factors, and then here's who you call or contact your primary provider, or talk to your barber or beautician about this, right?
Yeah.
Learn more about it. Learn more about your health through speaking to your barber beautician. So I think though that is also helping, because as they're waiting in the waiting rooms in our facilities, oftentimes they're looking at material. And if there's a poster that draws their attention to, or say, like, you got this big picture up here that says, let's talk. Maybe it says, talk to, when you're in the chair, talk about colorectal screening. You know what I'm saying?
It's a great idea. Great idea. We can get you guys that stuff too.
Yeah, and then that say, oh, I saw the poster and it says talk to you about this, and then of course we educate all of our folks in our facilities, and then if nothing else, we can show them the card, the laminated card, or steer them in the right direction, or say, hey, it's on our YouTube page. Go to our YouTube page and watch the presentation. It could be as simple as that.
Mm-hmm. Do you guys feel comfortable bringing up this topic to your customers?
Absolutely.
And I think any literature that you could provide that we can place in our shops would be great.
I also think with the pandemic and us spacing the customers further apart, then there's that opportunity to talk to them more one-on-one too.
Yeah.
Yeah.
That's awesome.
I think one main talking point I'd love for you guys to get across to them is, like we talked about, asking the family history. Because like you said, a lot of people don't know, and maybe, they know someone had cancer, but they didn't know what kind, and they didn't realize that impacts them. So making sure that they know that, hey, the family history actually impacts you. You could be at higher risk. So telling people to just go out and ask those questions of their family and bring it to their doctor is so important.
And if I may reiterate, I love the idea of the laminated poster that says, talk to your barber or your hairstylist about colorectal cancer, because we do have a clearer understanding where we can present it better.
Right. Absolutely. We can do that. We can get those developed.
Okay.
Do you guys have any questions about the topic that we presented? Was it all clear? Did you have any questions that we didn't? Because we could talk for 3 hours on this topic. We couldn't hit everything, but was there anything that you were wondering about or wasn't clear when we were presenting it?
Yes, I did hear earlier, I believe it was Dr. Wilhelmina Sizer that said, with treatment, you have a promising of 5 years. Is that what I heard?
So Aretha, you broke up a little bit, but I think you were talking about when I said it was preventable, treatable, and beatable. And then the meaning behind that was, so the colonoscopy serves as prevention for colorectal cancer. And then if a cancer is detected in the earlier stages, with treatment at 5 years out, there's like a 90% survival rate at 5 years out. So it's a good survival rate looking out 5 years.
Okay. Yeah, when I heard that, I thought you were saying with treatment, you live the 5 years. And I'm like, wait, I gotta find out. So
yeah, so 9 out of 10 people, if they get their colon cancer found early, they will still be alive at 5 years and they'll be cured. If it's found at stage 1, cured.
Okay.
So that's why, doing the colonoscopy so we can either prevent it or at least find it early can really save lives.
Okay, thank you.
You're welcome.
The last question I have or draw attention to, because I think it kind of breezed over it, for individuals who the barrier to them may be, well, I don't know if my healthcare provider is going to pay for this, or they feel that they don't have adequate healthcare. Again, I think it was mentioned, it was talked about, what the recommendation to those individuals who say that is a barrier for them.
Number one is reach out to the cancer services program of the Finger Lakes. So going to getscreenedrochester.org, and that will bring you to the website there. Their phone numbers there. You can email them there, and seeing if you qualify to be enrolled in their program. Because if you do, and it's based on finances, Even if you have insurance, if the copay is too high or the deductible is too high, they will cover the screenings for you. The other thing to know is that health insurances do need to cover colon cancer screening starting at age 45. So it is covered. It's just a matter of some people are on high deductible plans. They can't afford to use the insurance they have, or some people don't have any insurance, but it is covered, and there should be no, you shouldn't have to pay much if it's done as a screening test, which is the point. There's a lot of information on that getscreensrochester.org website about all of this, different resources, and what to do if your insurance tries to give you a hard time. There's even appeal letters on there, but bottom line is it is covered starting at age 45 for screening. And if finances are a barrier, the Finger Lakes or Get Screened Rochester program is available.
Wonderful.
And we can get you guys brochures on this program as well to put in into your shops.
Okay.
So, so next month, June, it's in the works that part of my program, I have to do a project. So in June, we are visiting Willie's shop, New Creation Shop, on a Saturday, where we will give out some posters, these laminated cards, talk to the barbers, give them some education, and hopefully get the ball rolling about educating the patrons about colorectal cancer. And then we'll be on site to facilitate that process. There is some regulations part of being in school, but once we are done with Willie's shop, we want to open it up to more shops and more beauty salons, targeting especially those areas that had that dark orange color, that had poor screening rates. So within the next couple of months, we're looking to expand out to more barbershops, more beauty salons, to kind of capture more patients who need to get screened, and let's get them screened so we can make a difference in these numbers that we were talking about tonight.
Well, are you finished, Wilhelmina? I don't want to. Okay.
Yeah.
Okay, wonderful. I want to thank Wilhelmina and Dr. Marino and Jana Darlington, who unfortunately was not able to make it with us this evening, and to everyone that Vice President Wade Davis, and to our member Aretha and Lady V, and all of the people who will be listening to this and will be looking in and logging on. We will be putting this on our Facebook page. We'll be sharing this link with our friends. We want others to share the link with your friends, and so that they can get educated around this a very, very, very important topic. And I look forward to you guys coming to the shop in June, and we also look forward to you opening it up. We have members who are in those zip codes. Andre's Barbershop is in that zip code. Wade Davis is on Culver. He's in that zip code. Of course, I'm in 14608 and 11 zip code. Aretha is in an area that I'm sure is close to that zip code. So many of our shops, and then we have one of our new members, Carlos, in the Latinx community, who is also, I'm sure, will be willing to share this with his Latinx community as well. And so we're so excited, we're so grateful and encouraged. And I feel a lot more comfortable about taking this screen in July. I thank you guys for connecting with me to get screened, because I wasn't thinking about doing it. I thought I had to wait till I was 50. I'll be 49 this year. I thought I could slide for another year, but I'm so grateful that I'm going to get it sooner than later. And because I do have some of those, as Wade was saying, some of those things I've seen on there. I'm pre-diabetic. I have some of those risk factors, and so I want to make sure, and I want to be around a while for my family, of course, and for this community. So we just want to thank you again for this presentation. We look forward to working with you guys in the future. UPBCA is not just barbers and beauticians. We're also appearance enhancement industry. So nail technicians, tattoo artists, anyone in the appearance enhancement industry. We have a pretty broad base of individuals that we work with. And so we're going to be sharing this information to as many people as we possibly can. And we look forward to, like I said, continue to getting this information out. So thank you so much. And thank everybody for listening tonight. And we say, continue to stay healthy, protect your circle, and continue to go and get tested and get screened. All right. All right.
Thank
So
you for having us.
God bless y'all. Thank you so
Thank
much.
you.
Bye.
Thank
all.
you.
Great
Great
night.
night.
And I'll make sure I send everyone the link. Good night.
Good night.
Hi.
That was great. Thank you, Willie.